Are you struggling to understand which antipsychotic medication actually works for schizophrenia, bipolar disorder, or other mental health conditions? With so many drug names, it is easy to get overwhelmed, confused, and even scared when starting your treatment. So, I even remember a patient who came in frustrated after switching medications multiple times, each time hoping for relief, but only ending up getting more side effects. That's why in this video, I'm gonna break down the most important antipsychotic drugs you need to know. When you watch this video till the end, you will learn how to address this issue quickly. So stick till the end of this video and I will provide simple and effective tips to make your treatment smoother. I would love to know where you are watching from, so drop it in the comment section. If the tips are helpful, please subscribe to the channel. Let's get started right away. Antipsychotics. We have typical and atypical. Let's start with the typical antipsychotics. The mechanism of action. It primarily blocks the D2 dopamine receptors. Indication is that it reduces the positive symptoms of schizophrenia like delusion. It also used in acute psychosis, bipolar disorder, and it also have this antiemetic activity. The drug types here, we have molindone, clozapine, trifluperazine, pimozide, prochlorperazine, quetiapine, chlorpromazine, quetiapine, chlorpromazine, risperidone, high potency and low potency. For the high potency, we have haloperidol, fluphenazine. For the low potency, we have risperidone, triflupromazine. Okay guys, the tips here for the low potency, they are less likely to produce this acute extrapyramidal reaction, and they are more likely to produce sedation and postural hypotension. They also produce dry mouth and blurred vision. While for the high potency, take note of that, they only produce the extrapyramidal effect. You understand? So guys, let's talk about the side effects with typical antipsychotics. We have extrapyramidal symptoms, we have hyperprolactinemia, we have sexual side effects like impotence, infertility, gynecomastia, galactorrhea, amenorrhea, anticholinergic effect, cholestatic jaundice with chlorpromazine, sedation with chlorpromazine, tardive dyskinesia, neuroleptic malignant syndrome, retinitis pigmentosa with chlorpromazine and choridazine, cardiac arrhythmias with what? Choridazine. Guys, let's talk about the other side, the atypical antipsychotics. So let's talk about the drugs. We have clozapine, risperidone, aripiprazole, olanzapine, quetiapine, risperidone. Mechanism of action here, we have the antagonism of D2 dopamine receptors with what? With 5-HT2A serotonin receptors antagonism. The indication for the atypical antipsychotics, we have schizophrenia, major depressive disorders, reduction of both positive and negative symptoms, and bipolar disorder, and also lastly, the treatment of resistant patients with what? With clozapine in particular. So the side effect with atypical antipsychotics, we have reducing extrapyramidal symptoms, agranulocytosis with clozapine, dry mouth and blurred vision with clozapine, metabolic syndrome like what? Weight gain, dyslipidemia, diabetes. We also have these cardiovascular issues like what? Like QT prolongation, orthostatic hypotension. We have cardiac arrhythmias with what? With risperidone. We have sedation with quinine and olanzapine. So bye for now. Please subscribe to the channel Expert Medics. Let's make more impact.